Hi guys, it's Nereida Boyle, your health educator here at the Fresno American Indian Health Project. I'm here with part 4 of our breastfeeding series. This will conclude our series. And in the first part, if you've been following us, we talked about the benefits of breastfeeding. For part 2, we dealt more with positioning and other tips. And our third part of our series, we talked about storage and pumping. And I was going to conclude it there, but I felt like there was something missing that we needed to touch upon. And I was connected with Ms. Carmen Moreno. And she'll tell you a little bit more about herself and the background, because I really thought and felt it was important to get a perspective for someone who was Native, who also has had lots of experience in the fields. So here we are today. So it is my pleasure to introduce Ms. Carmen Moreno. Carmen, if you want to go ahead and introduce yourself, tell us a little bit about yourself, your experiences, and why you think culture and tradition is important to you.
Sure. Well, let me start off with he yajo yokuts Niaminyana hayo is the hoage. Niam magani niam Carmen Moreno. Nata inyana ama ipinich na Tachi ama Wukchumni. So my name is Carmen Moreno. I am Native. I am half. I am Tachi and Wukchumni. I have experience in the medical field over 20 years. I started off as a medical assistant, and I ended up becoming a health educator for a clinic, which I did for 12 years. Eventually, I ended up playing a big role in OBGYN and working with prenatal care classes, labor classes, breastfeeding classes, and eventually I end up transitioning into breastfeeding education, and I really have a big passion for breastfeeding, helping moms. So I became a certified lactation educator and a certified lactation consultant, which I did that on my own because I wanted more knowledge to help my moms. And that's it. I don't know if I missed anything else.
Just tell us a little bit more about your family. You mentioned, I do want to mention that prior to this interview or this recording, we were connected, and I was just amazed with your words. I think I shared it with anyone who crossed my path, what I had learned from you. And I felt it was very important to share your story and your experience from someone who is Native, who has both that experience from the medical field and the cultural perspective. So that's why we're here today. And
Sure.
you did share with me a little bit about what the area you grew up with and your family. So if you don't mind just sharing a little bit about that.
Sure. First of all, I was speaking in Tachi. My mother's Lawona, Icho Jasso. She was full-blooded. She was Wukchumni and Tachi. I was raised really close with my mom with the language, our cultural traditions, and later on I ended up becoming a basket weaver, working with the language. And now I do beading, but that's my relaxing time. But I do incorporate that with my family, and they all have their own how would I say, their own talent. One's really good at basket weaving, one's good at beading, and the other one's language. My oldest daughter, she graduated from UC Merced, so she actually was focusing on Native American history because it was important to our mom to carry our traditions, our language, and to share it. And the important thing was to give our side of the story. That was really important to mom, our Nohom, and my mother also taught the language. So with that, my upbringing was really close to my mom. We were farm laborers. We worked in the fields. Even though I didn't grow up on the reservation, I was there frequently with my mom, going to see our family, and that made her happy. It made us happy. We are actually long, how would I say it? Our great-great-grandmother was a famous basket weaver, Maggie Icho, and then also on my grandmother's side. So we've been really close to taught how to respect, you know, ourselves, our family, and most important was based on family. Family was like the center of everything we did, and so my mom had instilled a lot of things in us, and we also included it with our children, or my daughters. And so my oldest, I said she's a history person. My other daughter, she wants to go in the medical field because she sees where there's a lack of with our culture that needs more support. And my youngest daughter, she's actually in the language program right now, working with my brother. So to say that even though my mother has gone, she has instilled us to carry her legacy on. And so I feel like it's more of I always say it's more like a responsibility. And just like a mom, that's what she showed me as a role model. She was really, really, really important to me.
Thank you. Thank you for sharing that. And before we get into, and actually you feel free to we don't have to go in any particular order, but I wanted to get a little bit more, since you do have that experience in lactation or breastfeeding, how did you develop that passion, and what are some of the benefits of breastfeeding that you can share with us?
Sure. So I'm gonna kind of go a little bit backwards here. So where it initially started, that that initial passion of working with breastfeeding moms and pregnancy moms, is that I was a young mom, and during that time, we had limited resources and support, and breastfeeding at that time was not something that was really supported, I guess. And it was just because we were limited of what resources we had. And but with that, what happened is that my mom was unable to breastfeed her babies, and she ran into the difficulty of feeling guilty of not breastfeeding her children because of the situation that she ran into. You know, one, she had an emergency C-section, and two, it was just, they were not supporting her at that time. They were really pushing formula at that time when my mom was having children. It was almost like a sense of, you should use this and don't breastfeed. Breastfeeding is not, you know, they thought of it as a bad thing. But my mom felt really guilty for that, and because her mother did, and her grandmother did. So there was a sense of, my mom felt like there was a break of tradition. But so when I became a mom, I did the best that I could have done at that time. But I went to my mom, and I kind of didn't know how to approach it, like to tell her that I want to breastfeed, and I don't, the doctor don't talk to me about it. And I mentioned the last time when I spoke to you is that I even actually went to the library, because I was still in high school at that time. That's what I mean, that I was a young mom. And at that time, whatever's in the library was so old. And so my resources wasn't that good. So I just remember my mom talking to me about my grandmother's experience with breastfeeding them, and how she mentioned that there was a break in our native culture, that it was thought of as a bad way, kind of evil way, I guess, and that wasn't true at all. It was just what was being brought into our mindset at that time. And what came out of that was that my mom said that this is an inner circle that starts with a mom from the beginning, from the pregnancy till you have the baby, and that's basically the bonding. So being a young mom, when I originally went to the hospital, I had my little one. I was really struggling, and I just remember feeling like I couldn't do it. And I remember feeling so guilty and so overwhelmed. And my husband at that time, you know, he supported me the best he could, but he didn't know anything either. So we're two young parents trying to figure something out. So it was really funny. But what I do remember was actually participating in a childbirth class, and it was very awkward for me because I was a very young mom, and the situation I was in is a different kind of atmosphere. But I remember the labor coach talking about breastfeeding was one of like the episodes, like at the very end, classes, I'm sorry, at the end. And it was very minimal, but whatever she did speak about, I remember her talking about the you know, when the milk comes in, keeping the baby skin to skin, also getting that baby latched, how to do it. It was almost like driving a car. There was a lot of instructions, but when you're actually doing it, you're really nervous. Mm. So, and you didn't want to get it wrong. That's what I remember feeling. But I remember being in the hospital, looking at my new baby, and I realized that's a part of me, you know. And our journey is long sometimes, you know. But this was something that I wanted to do for the baby. So, I end up experiencing all the things I think you could possibly, you know, engorgement, blocked duct, and, you know, by learning that, I think when I went through that stuff by myself, I mean, not no medical or educational stuff during the pregnancy and during breastfeeding and postpartum, no one told me the changes that I was going to expect. And what to do. So I think that's where my passion came from, was like, I was a young mom. We were limited resources. Like I had to drive like 45 minutes to a doctor. It was just, we were very limited in our area. And so with that, when I went in the medical field, originally I wanted to become a nurse. But then our path changes. It's never set. Our path is always different than what we plan it. But anyways, my background came from, I want to help people that are limited in resources, and you know, and what I mean by that is our income. You know, so I worked for a clinic that was for like farm laborers, and then eventually I moved to another clinic that was more like an inner city but low income also. So I was very compassionate, sharing it with the moms of my experience. But that's another thing that you kind of want to limit. You don't want to push your experience on them, but more so like the where your resources are, advocate for them and educate them, so that way they might have a better outcome, and not get discouraged. And also remember not to forget about themselves as a mom also.
Okay. And what do you think, having your medical experience or with your own personal experience with your family, what do you think are some of the current barriers, or what's preventing a lot of women from initiating breastfeeding and or continuing to breastfeed past the recommended 6 months exclusive breastfeeding?
Okay, so we have to look at their environment, you know, and their support system, not to mention, you know, how they feel about it. I don't think anybody asked the moms, like, how do you feel about to breastfeed? You know, and it's okay for them to feel scary, and it's okay for them to ask questions. And I think sometimes we don't want to because we feel guilty, you know.
Yeah.
So I think providing them with education and support is one thing. The other thing too is that it's depending on what environment we're at. You know, we're inner city, you know, it's a little bit more, it's hard, you know, because breastfeeding is, what I liked about breastfeeding is I didn't have to make a bottle. Yeah. You know, you have to carry the better because you already have the diaper bag, or, you know, and then now we have a bunch of other stuff, right? We have our phones, we have our purses. And so I like that I didn't have to warm it up. I didn't have to find somewhere, you know, to warm up my milk. And I think, so for sure is letting everybody that it's a normal, natural thing that was started so many years ago, you know, before we had any Walmart or any, you know, formula, or there's no running late to the store. And you know what I mean? It's just like, it's easier access. But I think that's what a lot of the moms were running into, that struggle, and the working moms, like, how are they going to put this in their schedule? How are they going to make it work? You know, that was a big issue when I was working in the clinic. And then I had moms that were students. So the being comfortable with themselves to be able to pump somewhere, you know, at the school, you know, like, how do I do this? You know, I don't even know if they do this, because not until you're pregnant, then you start asking questions. You don't think about those questions before. So, you know, knowing that they, you know, where you're at, they're supposed to provide a place where you can breast pump, you know, and that way with your, you know, your milk. And the support system is another thing. And I mentioned that I had my mother and my husband, but I know, being an educator and a lactation consultant and an educator during the whole time, I had moms that were different ages, came from different backgrounds, some very, you know, not in a very supportive environment from home. And those really touched my heart, because we had to make something work that they didn't know if they could do themselves. And especially if they were being told, like, I don't know why you want to do that. You know, why would you want to do that? You know, that's, you know, oh, then you're gonna have to be, you know, how are you gonna cover yourself? And, you know, there's different ways now, and it's more of being of a shift of a norm, but it's just getting started is the hardest part, being comfortable with yourself. And I think those are the kind of, to me, the three things, is like the environment, the support, and then feeling comfortable to do it. And I think if you have some moms that are breastfeeding to moms that are maybe pregnant, they can, you know, interact with each other and be their own support system, their own little tribe, their own little village to support each other, so that way they can kind of help them along. And the other thing that I always, my message to my patients were, I understand it's a commitment. I understand it seems like long hours, and, you know, like, I don't know if I could do this, and that's okay. It's okay to be, scared. But just know that now you have more resources and support. So if you don't have that inner circle at home, like whether it be your mom or, you know, an auntie or, you know, whoever, we all have different support system. We also have, you know, those other breastfeeding support systems like La Leche League, you know, maybe even a breastfeeding coalition. They have classes. Where I used to work before, our breastfeeding lactation person actually wouldn't charge. That was our agreement. If we were going to educate and support these moms, if the moms didn't have private insurance, or if they had private insurance and it's just like they're out of the pocket, it's way out of hand, the services were free, because overall our goal was to help these moms to breastfeed and feel confident.
Okay, and you mentioned some resources. We also want to throw in now, there's WIC, the hospitals. A lot of time, if they do have private insurance, there's services that may be available to them. So just making sure that they ask the questions, they ask what resources are available to them.
Right.
You mentioned La Leche League. So I think that's really great that you mentioned that. Now, shifting to, from a medical standpoint, what are like some of the benefits of a newborn ingesting or drinking from mom and getting that breast milk?
Okay, so first of all, starting your prenatal care and getting it during the pregnancy is important, because that's going to affect our outcome on during postpartum and breastfeeding. So making sure you're taking your prenatal vitamins, making sure you're keeping your OB appointments. If you end up have to see a nutritionist, you know, keep those appointments, so that way we have a better outcome during delivery. Now everybody's outcome is different. So what I mean by that is that what if it ends up being an emergency C-section? You know, how's that gonna plan out? But if it's a delivery, it doesn't matter if it's a C-section or a normal delivery. The first thing is try to get that baby on skin to skin, like right after, so that way you start producing those hormones. And basically it's like putting the baby on the skin to skin is getting that the hormones going to start to stimulate that breast, you know, to start ready to let the prolactin, so to release that milk when it's time. The very first milk is very important. So it's called colostrum milk. I call it the gold milk. So, and it's very minimal, but it's very important. So whether you breastfeed your baby for a day, a week, a month, a year, even after the recommendation, because now it's even past, you know, the 6-month mark that everybody always calls out. But that colostrum milk has multiple, you know, nutrients that it does not measure up compared to formula. Formula is a man-made, you know what I mean? Like it's made from a cow, you know. So my thought is milk for a human is made for a human. And so you want to try to reduce, you know, allergies, you know, and especially in our culture, we have a higher rates in obesity, diabetes, you know, hypertension. So that whatever we can reduce for them later in life is almost like another boost for their health. So it's also being a mom, you're already starting to look out for them for later on in life. But not only that, it helps with their immunity, especially during this time, during the pandemic. You know, there's not a lot of studies on it, but it is saying that it's helping at some point with their immunity. So whether it's a very little or a lot, something is better than nothing. And also, we just have to kind of make sure that they get that support system, latching that baby on. How do I prepare? And most importantly, moms, don't be afraid to ask for help. Don't think there's any silly or dumb questions. There is none. You have to ask because this is your body and this is your baby, and you have that right.
And during our previous conversation, you did mention something to me that I had never heard about. But what if baby is born early and they're in the NICU? And then you had mentioned some suggestions of how you can encourage that pumping and have the baby know how to nurse when they are released from the NICU.
Right. So during my studies and during our, like, you know, our evaluations and actually working with parent moms, what was taught to us, what came across to us is that there was this method of helping the moms that are having preemie babies. So first of all, these babies that are born early, yes, they have everything else, you know, that has to mature. So the other thing is their muscles within their jaw and their mouth. So it's not as strong. So to kind of help them prepare, if the baby's in the NICU, the moms usually have to pump while they're at home. You know, unfortunately, usually the mom gets discharged maybe 2 days later, baby's still in NICU, mama goes home. Mama's told to pump your milk and, you know, save it and bring it in. So first, this even goes for the moms that are just pumping milk. You know, you have to get in that relaxed mindset, because if you're all tense and you're stressing out and you're thinking about the load in the washer and the dishes in the sink and you're trying to get the other kids ready for school, you have to get in that relaxed mindset so these hormones can kind of help you release down that milk. So first you have to be in a relaxed environment. What I mentioned is that to ask your NICU nurse if they can possibly give you the baby's receiving blanket that they were wrapped in. And there's a study that says that if the mom smells that, if they smell that receiving blanket, it actually kind of sets off like a hormone in the brain to kind of start releasing that milk or start to like tingle. But so that will help to kind of stimulate, you know, to the mom to kind of relax. 1, 2, if you smell it, you're thinking of the baby and it helped relax, and those hormones will kind of help to release that milk down. Also massaging the breast, and there's different ways with that, but you don't want to rub too hard because you don't want to get like inflammation on the breast either. But what I had mentioned is that when the moms go for the visit, maybe ask the nurse, you know, there's different way they do feedings, and sometimes they can put the baby's, the mother's milk in a little syringe, and it has a little tubing, and they tape the tubing close to the mom's breast. And so that way it's almost like if the baby is kind of like getting the milk, it's dripping into their mouth, but it's also helping to stimulate the breast. So that way, when you go home, you're able to produce more milk. You got to keep on, the thought is try to keep on feeding so you can keep making more milk. You know, resting the breast and getting full, I don't know where the thought came in, like, I will get more milk. No, what the problem is that it's like you're almost shutting the faucet off, and then eventually it's not going to turn, it's not going to open. You have to kind of keep that, you know, water hose going. So
Yeah, I heard it referred to as a supply and demand.
that's exactly what it is, supply and demand. So you know, wrapping that baby up in the blanket and asking for that blanket will actually help to kind of stimulate the hormones to produce milk. And also, if you can try to even just put baby at the breast when you go for those NICU visits, it will help also to kind of prepare them and to kind of start, you know, with a little mouth. And of course, there's other devices and other stuff that you can use, but the most important is the latch. But when they're preemies, they need a little help. So that's kind of like the training wheels before they come home. You know,
Awesome.
so I
Awesome.
hope that helps.
No, yes, perfect. And what I really, I think it's great that we're talking about little tips and suggestions about how to initiate breastfeeding, the benefits, a lot of stuff that thankfully now is really getting promoted, but has been traditionally done for centuries through different communities. But from your cultural background and tradition, tell me what was taught to you and from, you know, your families, your aunties, your grandma, your mother, about how this maintains tradition and culture and for future generations.
Sure. So I'm going to kind of start from the beginning because this kind of goes together, but it was looked at as birth and breastfeeding. It's very sacred to Native Indigenous women, and actually, it's in any culture, you know. But it's a traditional natural circle that is like a spiritual connection between the mother and the baby. This is how I was kind of told, and it's a natural food from the beginning. It's almost like a mother's way of protecting that baby. You know, it's like I said, we didn't have, you know, well, not we, but our older generation didn't have no Walmart or, you know, anything to be going to go purchase anything. So they used what was naturally taught to them by their mothers and grandmothers. The other thing is it's a belief that it brings strength and nourishment to the little one, almost in the manner of medicine. So when my mom told me that, I didn't quite understand. I go, what do you mean by medicine? She goes, well, just like the way, you know, the way we, you know, we do certain things, we call it medicine. Medicine can be anything from food you eat to home remedies, herbs that we use to maybe help with our sprains or cuts, you know, and she taught me all that, but she said it's a medicine that a mom naturally is providing to the baby so that way they stay healthy. And so that's why I mean it's like a form of medicine. That breast milk is a form of medicine. And that's why I say whether it's one day, 1 week, 1 month, it's something that you're passing on to that baby. And just skin to skin is really important. But my mom explained it to me in this manner: was having the baby close to your heart means that, you know, they're going to turn out to be good-hearted people. And it made me feel good because it made me feel like, okay, you know, having this baby on my chest all the time is, you know, it's not me being, you can never spoil the baby by over loving them and hugging them. Or actually, it makes them more dependent when they get older. That's what the studies show. But what my mom taught me is that it makes them a good-hearted, how to say, good-hearted, and it's just yoke. It's a good, you know, good people. And then the next thing is there's a need for us to kind of go back to breastfeeding, our tradition that was done so long ago. Is we just want to help these little ones become healthier, and you know, to try to reduce the changes that happen, you know, within the foods, you know. And I talk about hormones in the foods and stuff, you know, and I know it's hard. It's hard because we're taught to eat one way, and but I think with helping the babies in the get-go, that will help them.
And the first time we spoke, you shared a story with me that I had never heard of. I believe you said that in the 60s there was this big push with, I believe you said nurses or people that were contracted to go out to places like the reservations to really push and promote formula. And you shared a little bit about how that was initiated and what ended up coming from that, and how there was a shift, and how then based on those results, people started going back to the traditional natural ways with, breast milk, looking at breast milk as, the best medicine for that baby. Do you want to share a little bit about what you shared with me?
Yes. So not only I always try to give myself more like look into more information and stuff. And as I was coming across I was getting ready for a test for one of my breastfeeding, CLC class. And so they actually gave us a topic that we could pick on our own. And so I picked one, and but I also talked to my mom because I felt like she was aware, she was in that time that we were going to discuss. And so I went over it with my mom. I said, okay, I'm gonna do my topic on this, but I don't know if this is true within our people, so what it goes back to is basically once everybody was being removed from the land and being pushed off on reservations, there was, of course, a change of, we weren't getting our natural foods that we were eating. And we were becoming dependent on the rations and the foods that were provided to our people, but also there's a change in our genetics that our shift of natural food into these other foods kind of changed the outcome of how the babies were turning out. And what I mean by that is it was almost like a brainwash setting from the settlers to the natives, to the women, that their milk was not good enough for their baby, that they should be put on this milk or powder milk, which is formula. And what happened was a lot of those babies, if they were not able to have access to it, a lot of the mortality rate had went up on the native babies. But also, not only that, there was a change in the way they took that milk in, and a lot of them had allergic reactions. So my mom did tell me that, they did mention, and that back east, there was a lot of natives that lost a lot of their babies during that time of that shift of being moved off to the land onto our reservation. And there were limited resources of what they had. So they had to use what they had, but unfortunately there was a lot of loss of babies. It was, I can't remember the number, but there was a big loss in infants. So once my mom had us, which for me, I was in the later 70s, but she said there was still a push for formula, and the doctors made it seem like there was no other choice. And my mom was very frustrated because she was trying to actually want to breastfeed me, and he told her, your milk is not good. This is the best option for your baby. And so I think what happened in that generation is that they finally kind of like, okay, well, maybe we can't do it, but we're going to teach our children to go back to the basics. And even though if some of these moms didn't breastfeed, they were actually trying to encourage the new moms to try to breastfeed, so that way there's a different outcome than what it was, from when that change came in. And so that way, going back to the natural way, our Native women had like an inner circle, and support from the moms, like you said, from the mothers, grandmothers, aunties, relations, and they were always giving like support and information. So that I think is so important, is like that generation felt like they couldn't do it, but they want to empower these other moms that came after them. And I think that's almost like where you start seeing the shift in the 90s. Is like, okay, it's starting to come almost full circle. And it's not only natives, there's everybody seems to be doing it. And of course, there's benefits for the baby. You know, we talked about it, you know, the bonding, you know, not as sick, immunity is a lot better. But also for the moms, you know, that, you know, I noticed there was a change in the shift in the last 5 years when I was educating the mom, when I would actually tell them, also, if you breastfeed, you burn more calories, you start burning weight, you know, and okay, I'll do that, you know, and I do remember, well, now it's different, but I remember having my little ones after I had my first one. I was like, I'm going to breastfeed for 6 months because I'm trying to get back down, you know, to my weight. But it's also, you know, a benefit for the moms too. And for them not to feel guilty to hand that baby over. If someone asks, you know what, you want me to hold the baby? You know, that's okay. Hand baby over, go take a long shower. That way you gather yourself so that way you have enough strength to take care of that little one, you know. So and then just, you know, try to you're doing the best that you can. And no one's perfect.
Yeah.
It's just a road that we got to travel sometimes that might be a little bit bumpier than the others. But yeah, that was my mom's encouragement, was to like, her encouragement was to maybe going back to our natural ways might kind of help us be healthier, you know. And she had a lot of chronic diseases that was out of her hand, and she worried about me and my brother, you know, and her grandbabies. And she was so happy that I was able to breastfeed, even though it was hard in the beginning. But I also want to remind the moms that you don't have to be feeding your babies in the bathroom, okay? If you don't want, do you eat your dinner in the bathroom? No, you don't have to be hiding out in the bathroom. You don't have to be hiding out in that car when it's 100 and something degrees and, you know, your baby looks like a little wet chick underneath, you know. It's okay, you know. There's other moms doing it. It's just, you know, and now there's a bunch of different pretty little covers that they have, you know. You know, back in the day we had this big old blanket and poor baby's just, you know, sweating. But and it just kind of maybe kind of like make a little circle with people that do breastfeed, so that way if you come across something that you don't know, or making sure you do your resources. Also, like WIC is really good. But it's good to know all your resources, so that way if in case one place is closed and you go to another place, because it can happen. Friday at 5 o'clock, you have an issue and everybody's closed and you're like, oh great, now where do I go? And I have to stay like this until Monday.
No, I really like the fact that you brought up the shift in what the norm, and also in policies, because even me as someone who breastfed and continues to breastfeed 3 children, when I was in school, there wasn't a designated place to pump. So luckily I felt comfortable enough asking different folks to let me borrow their office for 20 minutes. There was only a place for staff to pump, and I think that's since changed. And luckily every place I've worked at since then has provided a room. So we do see that shift. Down to the Fresno Fair, there was a lactation room. There's this mobile unit here, at least in Fresno County, that would go to different events, and it was nice air-conditioned space to, to nurse, to change diapers. So I do see that shift. So I really appreciate that you brought that. And also just to reiterate what you mentioned, breastfeeding is free. It's the most nutrition. It's the best medicine for the baby. There's a lot of resources out there. It protects the environment because there's very little equipment needed. Like you said, you don't have to prep anything, and it really does honor values and tradition. So I think you mentioned all of that, and then you tied it back with your own experience, both in the professional field and with your own family and with your own tradition. So I really appreciate you coming here and giving us the opportunity for you to share that wisdom that is so valuable. So I really appreciate you. I want to remind everyone that there is a lot of resources, and don't be afraid to ask. As Carmen mentioned, that's breastfeeding is the most natural thing in the world, and it's the best medicine for that baby. And it really honors tradition. And if you have any questions, please feel free to give us a call here at the project. Carmen, thank you so much for taking time in your very busy day to share with us your experience and your wisdom. I think a lot of folks are going to benefit from this. Like I mentioned, if anyone has questions, please feel free to give us here on the call here at the project at 320-0490.